How does a TB biopsy diagnose tuberculosis? Have you ever wondered how doctors confirm a tuberculosis infection? A TB biopsy plays a crucial role in this process. It involves taking a small tissue sample from a suspected area of infection. This sample is then examined to check for signs of Mycobacterium tuberculosis, the bacteria that cause tuberculosis. The need for a biopsy typically arises when other tests, like sputum analysis or skin tests, do not provide clear results. This is particularly common in cases of extrapulmonary tuberculosis, which occurs outside the lungs, affecting areas like lymph nodes, bones, or other organs. During the biopsy, a healthcare professional collects a tissue sample using a needle or through a minor surgical procedure. For instance, if a patient has swollen lymph nodes and tuberculosis is suspected, a lymph node biopsy may be performed. Once the tissue sample is obtained, it is sent to a laboratory for examination. Here, several tests are conducted. One important test is histopathology, where the sample is viewed under a microscope. Doctors look for granulomas, which are clusters of immune cells that form in response to the TB bacteria. Granulomas that show caseous necrosis, which is a type of dead tissue that resembles cheese, are particularly indicative of tuberculosis. Additionally, the laboratory may use special stains, such as the Ziehl-Neelsen stain, to identify acid-fast bacilli. This is a characteristic feature of Mycobacterium tuberculosis. Another method is culturing the tissue, which means trying to grow the bacteria in a lab setting. While this can confirm the diagnosis, it usually takes several weeks to get results. Molecular tests, like polymerase chain reaction, can also be performed on the biopsy tissue. These tests detect TB DNA quickly and specifically, providing faster results. The information gathered from the biopsy is invaluable. It provides direct evidence of tuberculosis infection in the tissue, especially when other tests are inconclusive. This is crucial for diagnosing cases where tuberculosis affects unusual sites or when differentiating it from other diseases that may look similar, such as certain cancers or infections. Ultimately, the results from the biopsy are combined with the patient's clinical symptoms, imaging studies like chest X-rays or CORT scans, and other laboratory tests. This comprehensive approach helps healthcare providers make a definitive diagnosis and determine the best treatment plan. In summary, a TB biopsy is a vital tool in diagnosing tuberculosis. It allows for a detailed examination of tissue samples to find evidence of the infection or related changes. If you suspect tuberculosis or have concerns, it is essential to consult with a healthcare professional for proper evaluation and guidance.